Okay. Hi guys. Now we're moving on to chapter 7. Okay. So now we'll look at specific bones. Okay. So um, chapter 7 is the axial skeleton. So remember that axial skeleton is head, neck, okay, and then the thoracic cage. So your trunk. Okay. Oh, what the hell's going on here? Okay. So this part we went over. Okay. So we are covering the skull right now. Okay. Okay. The skull is composed of cranial and facial bones. Okay. So cranium, face. Um, so the way this is kind of looked at, the cranial bones have 8 bones that surround and enclose the brain. Okay, they're the unpaired ones. So unpaired is going to be all down the middle. Okay, so ethmoid deep in there, frontal, okay, occipital, and sphenoid is also deep in there. The paired ones are going to be the parietal and the temporal. Okay, so the facial bones have no brain contact. That's what makes it a facial bone. Okay. So here's the skull. Okay. Okay. So I'll let you look at this. I don't think that's particularly important. Okay. Um, okay. So I'll refer back to these slides when we look at them more closely. Okay. So these are all great. Okay. The first thing I want to point out are the 4 major sutures. Okay, a suture is a jaggedy line. I'll explain more about what a suture actually is when it comes to joints. But a suture is basically when the joint looks kind of like this, and the 4 major sutures of the skull, like there's a jaggedy line across the skull. Okay, the coronal suture, lambdoid suture, sagittal suture, squamous suture. So first, coronal suture. Coronal suture runs across the frontal plane. So runs right here. Okay, it separates. Okay, the frontal suture separates this bone, which is the frontal bone, from the parietal bone. Okay, so you can see that here, the line that separates the red and blue. Okay, the sagittal suture runs through the mid-sagittal plane and separates the 2 parietal bones from each other. Okay, let me see if I can find one. There, that line down the middle is the sagittal suture. Okay, this line right here is the squamous suture. So your skull is dome shaped except for this part right here, which is rather flat. Flat is squamous, so squamous suture. Okay, this one in the back looks like the Greek letter lambda. Okay, so lambda is that. Okay, so lambdoid suture. Okay, Okay. So the small sutural bones, um, those small sutural bones are the little, that thing, that little green bone in the middle. It's just like where the two sutures don't fit well together. Okay. You'll see it. Some people have them, some people don't. Okay. And they're much smaller, like they're not, they're overrepresented in size over there. Okay. Okay, the calvarium or calvaria is the skull cap. Okay, so is the, if you ever seen everyone, people take the brains out, they have to remove this cap, and that's the calvaria. Okay, the base of the cranium, the base of the floor is called the base. Okay, like if you, the brain doesn't actually do this, but if you imagine the brain kind of sitting on the base, okay, it actually floats on the base, doesn't actually sit. And that's an important thing we'll go over when we talk about brains. Okay. All right. So frontal bone. So this is a frontal bone. Okay. The important thing about a frontal bone, this arch right here is called the supraorbital margin. It's the top of you. It's, you know, you can feel it right there, right underneath your eye when you come up. That margin right there is the supraorbital margin. Okay. It has a little hole here where the nerve pass through, called the orbital notch or foramen. Okay. Okay. The parietal bone isn't really interesting, except the parietal bone really has all the sutures, all four sutures attach the parietal bone to something. The sagittal suture attaches the two parietal bones to each other. The coronal suture, okay, attaches the frontal to the parietal. The squamous suture, okay, attaches it to the temporal, and then the lamellar suture back here attaches it to the occipital bone back here. Okay, so you're looking at this bone. So this is anterior, that is posterior. Okay, the temporal bone. This bone, there's a lot of different parts. Okay, so let's start with a big hole. Okay, there's a big hole there. Obviously, if you look at it, you know what the hole does. It's where your sense of hearing goes through. That little hole is called the external acoustic meatus. Okay, external, outside, acoustic, sound, meatus. A meatus is a wandering channel. So it's a channel, but it's not straight. Okay, meandering, right? So, okay. Now comes a whole bunch of processes. A process is a part of the bone that sticks out, and it usually attaches to like either another bone or you have a bunch of muscles that attach to that point. Okay. So here is the zygomatic process. Okay. This part down here is the massoid process. Okay. This little sharp pointy thing is the styloid process. Okay. All right. Those three things. Yeah. Okay. This right here is the occipital bone. The occipital bone is on a, it forms the back of your skull as well as some of the bottom part of the base of the skull. Okay. All right. So there's a couple of important parts here. Okay, starting with the big hole. Okay, the big hole in the middle of the occipital bone is called the foramen magnum. Foramen means hole, magnum means big, so it literally means big hole. Okay, here. Okay, these two curved surfaces, okay, are the occipital condyles. A condyle is a curved surface. So you have two curved surfaces here underneath there, and this two curved surfaces is what your head actually wiggles back and forth on. So when I nod, I'm actually moving my occipital condyles against what you guys will learn is the axis, or sorry, not axis, atlas. Okay. Okay. Other things, these two lines, okay, superior nocturnal line and inferior nocturnal line. All the like the muscles on the back of your head here, they attach to those lines. Okay. All right. This bone is called the sphenoid. Okay. The sphenoid is really hard to see. You can see parts of it from the bottom, but the best way to see it is actually take out the calvarium, take out the brain, and look down. Okay, here, sorry. Do you see how it looks like two sets of wings here? Okay, one set here, another set up there. Okay, if you look at it from top down, this is a top-down view. Okay, I'm looking at one set here called the lesser wing and a bigger set here called the greater wing. Okay. The other important features of this bone are the optic canal, where the optic nerve actually runs into the skull. Okay. And this little place right here called the sella turcica. Okay. The Turkish saddle. Okay, so it looks like a Turkish saddle. It looks like a saddle. It looks like a small little saddle, but it actually has back support. There's a big chunk right here that's the back support. Okay, the dorsum sellae. Okay, but that part, the name part is important, but that little piece makes it the Turkish saddle because Turkish saddles have back support. Okay. That little indentation, the sella turcica, is where your pituitary gland is. And when we get the hormones, you'll know exactly how important your pituitary gland is. So your sella turcica is actually a very important region. That's why it's so solid, wrapped up in bone. It protects the pituitary gland. Okay. All right, the next bone is the ethmoid. The ethmoid is the deepest bone of the skull. Okay, and it's rather hard to see from the skull unless you break it open. Okay. The only part that you can really have access to is this top part right here. That little red dot. You're looking at the skull, like you empty out the brain and you look down, and what you see is this. Okay. You see that sharp little point? It's called a crista galli. It's the little frog on the rooster. Okay. That's what crista galli means. Your meninges actually attached to that point right there. Your meninges are a membrane on the surface of the brain, and they attach to that point right there. Okay. The other thing, if you look past that, you'll see this plate here with a whole bunch of little holes in it. Okay. It looks like it's eaten away by acid or something, but those holes are actually really important. Okay. Those holes are called a cribriform foramina. The plate is called a cribriform plate. Foramina is a miniature foramen. Okay, those holes are where your sense of smell actually come through. The neurons that control your sense of smell come through those little holes. Okay. Okay, a fossa is a depression in the bone. Your brain, if I take out the skull cap and empty out your brain, I'll see there are three fossas, okay, and they get deeper and deeper. So the most shallow one is the anterior fossa, the second one is the middle fossa, and the third one is the posterior fossa. Okay. Okay. So the bones of the face. Okay. There are 14 facial bones that give shape to the face. They form part of the orbital and nasal cavities. Okay. They support your teeth. They serve as attachment sites for muscles of expression and facial expression and chewing. Okay. So here are the um, bones. Okay. Zygomatic bone. This is your cheekbone. Okay. It attaches to this long process sticking out of the temporal bone called the zygomatic process. I don't remember if I went over that or not. I'm thinking I forgot it, but that's an important thing coming off the temporal bone, the zygomatic process. Your zygomatic process and your zygomatic bone, this is what forms your cheek line. Okay. Okay. This bone right here is called the vomer. The vomer is very deep inside the nose, and its job really is to separate the left and right nasal cavities. Okay. This one is called the palatine. Okay. The easiest way to see the palatine is up through the roof of the mouth. It forms something called the hard palate. Okay. And then you have this plate called the perpendicular plate that sticks straight up and forms part of the nasal cavity. Okay. All right. The maxilla is your upper jaw. Okay. Your mandible is your lower jaw. Okay. Your mandible, there are bits and pieces that you need to know. Okay. The first one is the condylar process. Okay. Condylar, condyle, curved surface. Okay. Um, that is it. That attaches to the temporal bone and that forms a joint called the temporal mandibular joint, otherwise known as the TMJ. Okay, this is a joint that opens and shuts your mouth. Okay, and a lot of people have problems with this joint. Okay, okay. So the nasal complex. This is the nasal complex. Okay, otherwise known as nasal cavity. Okay, so um, I don't know why they didn't go over this bone, but I'm gonna go over this bone here. See the thing that looks like upside down question mark? That little bone is called the inferior nasal concha. Okay, the inferior nasal concha looks like that. It actually, when the air comes in, that little groove, okay, along with the middle nasal concha and superior nasal concha of the ethmoid bone here, these three grooves um, actually helps the air um, cause turbulence. Okay, so when you breathe in, the air kind of swirls around here in your nasal passages before it goes into your lungs. Okay, before it goes down to your trachea, into your lungs. Okay, and that helps moisten the air and helps filter out the contaminants. Okay, okay, nasal cap, nasal sinuses. Okay, uh, oral orbital complex or orbital cavity. okay, or just orbit. Okay, the three little bones in the inner ear. Okay, we'll talk more about these when we talk about hearing. But the three little bones are the malleus, incus, and stapes. Malleus means hammer, incus means angle, stapes means stirrup. Okay, and that's what they look like. Okay, the hyoid bone. The hyoid bone is um, located between the mandible and larynx. It forms the movable base of the tongue. Okay, the factoid about the hyoid that gets asked very often is that that's the one bone that doesn't articulate with any other bone. Okay, it hangs out by itself, like it's here. So if you imagine like strangling someone, you'll be crushing their hyoid. In fact, if you find a hyoid that's been crushed, it's an indication that person's been strangled. Okay, so that's the hyoid. Okay, that's the difference between males and females. Males and females, the females looks more gracile, more smoother, more childlike. Okay, the term is actually pediomorphic. Okay. 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 Um, so the skull. So fontanelles. Okay, fontanelles literally mean small little fountains. Okay, and what they are. So the hardest thing to do when giving birth is the head of the baby coming out. Okay, and those of you guys who have either experienced it or seen it know exactly what the hell I'm talking about. Okay, the baby's head actually has little gaps in it called fontanelles. Okay, so the brain, the head can actually shift a little bit. The skull can actually shift a little bit on the way out. That makes it slightly easier. Okay, and these things don't harden until about a year, which is why they tell you, never touch a baby's head right there because you can push your head through. And the reason they're called fontanelles is that they actually pulsate. Okay, and I've been teaching anatomy for a while, and I should know this, right? But the when we had a first child, um, one night I woke up. Okay, it's the middle of the night. It's like 4 a.m. in the morning, so not fully conscious. And my wife was breastfeeding the child, and her head, like I was watching her head, and it was just pulsating. There was like little areas pulsating, like up and down. And I freaked out. I was like, "What the hell is that? Like, why is it? Why is her head pulsating?" And she's like, "Oh, that's the fontanelle." I was like, "Oh, right, God." So and then I went back to sleep. Um, so even I can miss things that I know. So there it is. Okay. Okay. The vertebral column is made out of 26 individual bones. Okay. 24 of those are called individual vertebrae. Okay. Um, two of them are fusions of several vertebrae, and there's sacrum and the coccyx. Okay. So the sacrum is the back part of your hip. Okay. And the coccyx is what we call the tailbone. Right. Okay, so the 24 individual vertebrae break down into 7 cervical vertebrae, okay, cervical vertebrae of the neck, 12 thoracic vertebrae, okay, and 5 lumbar vertebrae. The easiest way to remember, breakfast at 7, lunch at 12, dinner at 5, okay? Okay, so cervical, thoracic, okay, lumbar, sacral, coccyx. Okay. Um, there are four spinal curvatures present in an adult. Okay, curves front, curves back, curves front, curves back. Okay, The first two curves, the first original vertebrae is C-shaped. Okay, you have your thoracic curvature and you have your sacral curvature. So your spine is C-shaped. The secondary curvature starts at 3 to 4 months of age, and they're the cervical and lumbar curvatures. The cervical curvature occurs first. It's pretty much done at 4 or 5 months of age. Okay, if you note, it does something. It allows the baby to hold its head up. Okay, so that's when babies can sit up and hold their head up. Okay, because it balances their head over the right spot. The lumbar curvatures occur a little bit later than that, and it shifts the trunk's weight over the legs, so it allows the baby to stand. Okay, and that finishes about a year, which is why it can stand in a year. Okay. All right. Most vertebrae have these things. Okay. Body, which is the weight bearing region. So this is the body. This is the arch. Okay. What else? The peduncles. These are peduncles. They're feet of the arch. Okay. On top of the peduncles are going to be superior articular facets. Okay. And on the bottom are going to be inferior articular facets. Okay, so the superior articular facets of the lower vertebrae attaches to the inferior articular facets of the upper vertebrae. Okay, that's where the vertebrae actually touch. They don't actually touch at the body. There's actually a intervertebral disc in between the bodies, so they actually touch only here. Okay, there's a hole here called the vertebral foramen. Okay, there's another hole here called the intervertebral foramen. Intervertebral foramen, you can't tell from one vertebrae. It's the hole left between two vertebrae. Okay. So there's an arch. There's an arch here. Okay. Superior intervertebral arch here. There's an inferior vertebral arch here. Together, you put them together, you get a circle. That circle is called an intervertebral foramen. Your spinal nerves run out of the intervertebral foramen. Your spinal cord runs through the vertebral foramen. Okay. The other things. Okay. So the spinous process. Okay. So the superior articular and inferior articular process attach the vertebrae to each other. The spinous process and the transverse process, they attach other things like muscles and tendons to the vertebral column. Okay. Okay. So transverse processes, spinous process. Okay. All right. One of the things we usually have you guys do, okay, is to tell the three types of vertebrae apart from one another. Okay, so this one is a cervical vertebrae. Okay, this one is a thoracic vertebrae. This one is a lumbar vertebrae. Okay. Okay. So they don't have a good, just normal. Okay. So let me just show you on this guy here. Okay. First of all, see these holes right here? Okay, on the side right here, not the big hole, that's the vertebral foramen, but on the transverse process, there is a big hole in the cervical vertebrae, and they allow the nerves and arteries of the neck to run up to the skull. So they are only in cervical vertebrae. Okay. cervical vertebrae also have a rather short spinous process. There's one exception to that rule, and that is C7. Okay, so if you reach behind your neck and you move your head up and down, there's a sharp point that you find on your neck that doesn't move when you move your head up and down. That point right there, that is the cervical process of C7. Okay, that bump, okay, is the spinous process of C7. If you push really hard above it, you'll find another bump, but that's deeper. That is the spinous process of C6. Okay. All right. This is the thoracic vertebrae. The thoracic vertebrae you can tell two different ways. The first way is the body of the thoracic vertebrae has these little bumps here called the superior articulate facet. Or no, sorry, it's called the costal facet. This is costal facet. Okay, and there's another bump there called the costal facet there, or it's actually called the demifacet. Okay, there where the ribs attach. Costal means ribs. Okay. All right. So the other way, if you look at the spinous process, okay, the spinous process of the thoracic vertebrae looks like a giraffe. Okay. If you see the ears of a giraffe here, the pointy face of a giraffe there. Okay. Yeah. This one, okay, is the lumbar vertebrae, and you can see here the spinous process is bigger and thicker and comes straight out and makes it look like a moose. Okay, let's see if I have another picture. These are thoracic vertebrae. These are lumbar vertebrae. See how it sticks out like this? It looks like a moose. Okay. Okay. The first cervical vertebrae is unique. It's called C1 or atlas. Okay. The atlas in Greek mythology is the titan that held up the world. The atlas in your vertebrae holds up your skull. Okay. The atlas is the only one that's missing a body. Okay. The body of C1. Okay. So the body of C1 is missing. It has become attached to C2. That is the dens right there. Okay. See how it looks like a little tooth? The other term for dens is odontoid process. Okay. That's the same word we get orthodontists and stuff like that. Okay. Or dens, tooth, from which we get dentist. Okay. All right. So there. Okay. But then used to be the body of C1. It's got attached to C2. So now I can do this. I can rotate one around the other. Okay. And so I can move this. That is this motion, right? I'm shaking my head no by moving C1 around C2. Okay. So that is how I shake my head. Okay. This used to be the body of C1. Okay. It became instead attached to C2, but now I can rotate my way around it. Okay. Okay. Sacrum and coccyx. So this is a sacrum. Okay. The promontory is right here. So sacral promontory. The sacral promontory is where, first of all, promontory means lookout point. Like lookout point that looks out onto the beach and stuff. Okay. As a promontory. Okay. The sacral promontory is important because that's literally where your center of gravity is. Your center of gravity is about an inch in front of that. Okay. All right, someone's really hurting it somewhere. That was a really loud noise. I'm not sure if you guys heard it, but anyway, that's why I stopped. All right. So the rib cage. Let's look at the rib cage. So here's the rib cage. Okay. So the first bone I'm going to talk about is the sternum or breastbone. Okay. So the sternum or breastbone, this bone right here, is split into three parts. So you see how it looks like a sword coming down, like a sword pointing downward? Okay. The sword has a sword handle, manubrium. Literally what it means, sword handle. As the body of a sword, and then the last part is this part called the xiphoid process. Okay, the xiphoid or xiphoid process. Okay, sharp little stabbing sword, the Fossa. Okay, that thing right there. Okay, that thing is made out of cartilage until about age 40 when it finally ossifies in the bone. Okay. All right. You have 12 pairs of ribs. Ribs 1 through 7 articulate directly with the sternum. Okay, so they're called the true ribs. Okay, in more scientific terms, they're called the vertebral sternal ribs because they attach to the vertebrae on the back and the sternum in the front. Okay, the false ribs are ribs number 8 through 12. Okay, because they do not attach directly to the sternum. Ribs 8, 9, and 10 attach to the sternum, but they attach to the sternum indirectly. Okay, so here's rib number 10. Rib number 10 attaches to the rib cartilage of 9. Rib number 9 attaches to the cartilage of 8. The cartilage of 8 attaches to the cartilage of 7, which attaches to the sternum. Okay, so they're called false ribs. The other true ribs, okay, the 11 and 12 are called floating ribs in addition to being called false ribs. They're called floating ribs, okay, or vertebral ribs because they don't attach to the sternum at all. The 8, 9, and 10 are also called vertebral chondral ribs because they attach to the vertebrae in back and to cartilage in the front. Okay. All right. So the ribs, that's all there is to it. Okay. They attach. So you can see here where they attach. So there's a little indentation here. So causal semifacet here. There's another causal facet there on the transverse process. So they're attached to the vertebrae in two different places. Okay. All right. Okay. So you can read that one on your own. Okay. So that's it for this chapter. I will see you for chapter 8.